From WRAL News and the Capital Broadcasting Podcast Network, this is the Coronavirus North Carolina News Brief for Wednesday, September 22nd. I'm Mark Boyle. On Tuesday, Governor Cooper and Dr. Mandy Cohen acknowledged some of the state's COVID metrics are leveling, but stressed they are still too high.
We're still averaging around 6,000 new COVID cases each day. And while the numbers are still too high, they have been relatively level and are at least not increasing further.
The average new case number is down about 13% from where we were 2 weeks ago. It's still 6 times higher than where we were 2 months ago before the Delta variant surge. And there's cautious optimism when we look at hospitalizations. The curve is going down slightly right now as we average about 3,500 people hospitalized with COVID each day. That's lower than the past few weeks. However, for the first time in the pandemic, 1 in every 5 of them is on a ventilator. Even though they are on the front lines of fighting COVID-19, some healthcare workers oppose the vaccine. WRAL's Joe Fisher talked to workers impacted by the vaccine mandates now in effect at UNC Health and Duke Health. One felt so strongly, she resigned.
At UNC Health, 95% of employees are vaccinated or received exemptions. At Duke Health, 98% of workers are in compliance with the new vaccine mandate.
Do you all acknowledge that you are in the minority?
Understood.
Yes.
I do.
These 4 healthcare workers are against the COVID vaccine.
But it absolutely is about our freedom. We should have the freedom to choose.
Lori Sherbico is a nurse at UNC Rex in Smithfield and got approved for a religious exemption.
I cried and prayed. I even asked God, I'm like, if I'm wrong, show me that I'm wrong.
The group is concerned about the safety of the vaccines, the quick rollout, and long-term side effects.
So I quit a job that I literally loved because I didn't want to put something in my body.
Brittany Minahan's last nursing shift at Wayne UNC Healthcare was Sunday. She received an exemption but resigned after being told she would need to test twice a week.
So why aren't we testing the people who are vaccinated? So you're discriminating me for not taking the vaccine.
Minahan is one of 60 UNC workers to resign, with the future of more than 1,000 employees hanging in the balance.
And we have contingency plans to mobilize folks and get them into the clinical setting so that we can continue to care for the sickest people in North Carolina.
I'm Joe Fisher, WRAL News.
This is the Coronavirus North Carolina News Brief. We post new episodes on Mondays, Wednesdays, and Fridays. Subscribe on your favorite podcast app. I'm Mark Boyle.